Because we're not doing PCRs, we do not have a really good handle on the amount of reinfection.
But experts suspect reinfection is happening, given that 81% of Canadians are double vaxxed against COVID, yet we're still seeing a sixth wave. After all, it's not an impossible scenario, says the medical director of the Vancouver Infectious Diseases Centre.
It is possible to develop COVID after having recovered from it fairly recently.
As recent as 3 months, says infectious disease Dr. Gerald Evans, though it seems one sneaky variant has disturbed the status quo.
Before Omicron came along, we did not see people getting any kind of reinfection until about 90 days had passed. With Omicron, that interval seems to be a little bit shorter. It's about 60 days.
It's still a rare occurrence, and it depends on 3 factors. Immunologist Ali Abdesatr says your age, vaccination status, and your immune response dictate reinfection. If you're a younger individual, fully vaxxed, and got a severe response to your first infection, you may get a hybrid immunity lasting almost 6 to 8 months. Bottom line, immunity from a vaccine is always better.
That concept that natural immunity is better is completely wrong.
As if it wasn't already complicated, Abdesatr says the variant you caught may also affect reinfection. Recent surges in the UK and Denmark suggest those infected with Delta likely develop immunity from all other previous variants. But an Omicron infection, with its very different makeup, will likely only protect you against another Omicron, yet may leave you vulnerable to all the other variants. The risk of COVID-19 reinfection in children now also in the forefront, as Quebec sees worrying pediatric hospitalizations.
Last week, 24,000 children in schools across Quebec were out because of COVID. That's a lot of children.
All the more reason to get those above the age of 5 vaccinated, and a strong indication for the need for boosters. As for how long you should wait to top up your dose after recovering from COVID, NACI puts that number at 4 to 8 weeks. Noor Ibrahim, Global News.